Imagine a system where life-saving organs are allocated, but factors beyond medical need or compatibility subtly influence who gets a second chance at life. How can we ensure true fairness and justice in such a critical, high-stakes process? Health equity is absolutely crucial for fair organ allocation because it directly addresses systemic disparities that can unfairly disadvantage certain populations in accessing transplants. Without a deliberate focus on equity, the allocation system, even if medically sound, risks perpetuating existing health injustices and widening the gap in health outcomes. The core mechanism for organ allocation systems, like that managed by the United Network for Organ Sharing in the United States, aims for medical justice by considering factors such as blood type, tissue match, waiting time, and medical urgency. However, health inequities introduce variables before or during this process that can create an uneven playing field. These inequities include unequal access to primary care, which can delay diagnosis of organ failure, or lack of insurance coverage, which can prevent a patient from getting listed on a transplant waitlist in the first place. Socioeconomic status can also impact a patient's ability to travel to transplant centers or adhere to post-transplant care, indirectly affecting their perceived candidacy. These social determinants of health are not explicitly part of the allocation algorithm but profoundly influence a patient's journey to and through transplantation. To foster health equity in organ allocation, efforts often focus on addressing these upstream factors. This includes initiatives to improve health literacy in underserved communities, expand access to health insurance and specialized medical care, and provide support services for patients navigating the complex transplant process. Furthermore, transplant centers are encouraged to review their own practices to identify and mitigate any biases in patient evaluation and selection, actively working to remove non-medical barriers to care. A concept known as distributive justice is central here. It refers to the fair allocation of resources, and in organ transplantation, this means moving beyond simple equality to ensure that social and economic disadvantages do not translate into unequal opportunities for life-saving treatment. Bioethicists actively study how policies can be designed to achieve this ideal, recognizing that fairness means more than just a blind application of rules. It requires understanding and mitigating the societal context that patients bring to the system. Ultimately, prioritizing health equity within organ allocation ensures that the gift of life is distributed justly, reflecting a commitment to societal well-being and reducing the impact of social determinants of health on life-or-death decisions. It moves us closer to a system where every patient has an equitable chance, regardless of their background or circumstances.